Well, tonight, some encouraging news at Desert Regional Medical Center. For the first time in several months, the hospital is under 100% ICU capacity. So what's different compared to earlier this year? And are there concerns about the variants of the virus? I spoke today with the Chief Quality Officer, Christine Langenwalter. Christine, it's nice to see you again. Thanks for joining us.
Thank you, Peter. Thank you for having us again.
What's the latest at Desert Regional?
Desert Regional, for the first time yesterday, we are under 100% ICU capacity. So there's a lot of celebrating in-house. We are within our normal footprint for ICU and are not in ICU overflow status right now. So that is very great news, very encouraging.
What do you attribute that to? The vaccine?
I attribute to a lot of things. I think the numbers for COVID have come down. We have currently 43 patients in-house with COVID. At a high back in January, we had 135. So I think overall case volume is coming down. A lot of these patients that have become very, very ill, it sometimes takes 2-3 weeks before they are able to go home or go to a rehab facility or to wherever their place of residence is. So they are in the hospital for a prolonged period of time. So with the decreasing testing numbers that's coming up, our testing rate, positivity rate has come down a little bit. And with that, a lot of our patients are going home. So it's really good news for us here.
Fantastic. What's different at the hospital now compared to the start of this year when we were seeing such a big surge in hospitalizations?
I think what's much different here now is that we have in our arsenal of tips and tricks and things how we can surge again if necessary. What rooms do we use? So all of that strategic planning and the things that we had to put into place over these past months, we now have ready to go at moment's notice if the need arises. But I think the biggest change is we're now starting to consolidate back to our normal footprint of operations. We've received dozens of assistance staff, travelers, contract staff through state agencies and local agencies and other help. And that's giving our staff a break so that they can take some time off and refresh. And we can now, look at those strategies and plans and improve them so that if the surge goes up, we immediately initiate those plans all over again.
There's some concern from state health officials about variants of the virus already in California, and that could drive up cases again in the near future. How concerned should people be about all these variants?
Variants is an interesting phenomenon. I'm on calls that talk about variants, and they all have different names and numbers for them, although it can get very, very confusing. I think the key thing to remember about variants is that here at the hospital level, we look for contact tracing. Where did the individual travel? Have they had a vaccine and it's failed? Other things. And so we look for symptoms of what might be evident in a variant, but we don't test for the actual variants here at the medical center. Our state labs and our county and national labs are doing random testing to see if the variants of things have changed. But here at the hospital level, we're not actually privy to each patient coming in knowing exactly what variant that they might have tested for. So I think the key message, the long and short of it, is that the vaccines are effective, they're safe. Individuals that have had vaccines, we're not seeing those individuals come back with infections. We encourage everyone to get the vaccine as it becomes available to their different group.
You mentioned masking. As variant cases grow across the state, health officials have recommended double masking to limit droplet spread. For anyone who's unfamiliar, what is double masking and what should people know about it?
Double masking may refer to using a paper disposable mask over your cloth mask to give it a double barrier, or the other way around, a paper mask with a cloth mask over it. I think the number one thing that's important about masking is that for a mask to be effective, you have to frequently change it. If you're using disposables, you should discard it at the end of the day. If you're using cloth masks, you should be washing it. And if you're using double masks, then don't count on that mask to protect you. Don't let down your guard from hand washing and from sanitizing and social distancing and those things.